agenda as we get started. So Tori is going to go ahead and start the recording. And if you prefer, you can log out and listen to the recording later. Otherwise, we will proceed with the recording. Thank you, everyone, for coming. So today's format includes an update, and we have to alter this a bit because of people's availability, but we will today include an update on ECE COVID response. We've got some information on COVID vaccines. Kara will be presenting an opportunity we're working on with lead water testing. We have Neuro presenting some opportunities they have for counseling. We always have our partner updates. So I saw Amy Carlo is on, and so is Jody Sherman for CCAP, and possibly, I don't know, but maybe we always invite the Department of Early Childhood. If they're available, we'll have a moment for them. And then we should have time for another opportunity with 9 News Health. I noticed they were on as well. And as always, please continue to use the Healthy CE COVID email for COVID questions. So we are going to have to come back to this because I know Carol had a power outage and is on her way. So I'm going to move down and come back to this. But I'm hoping Keith Rollins is on and can talk a little bit about the vaccination update.
Hi, Jane. Thank you so much. Yes, my name is Keith Rawls. I am the Immunization Program Coordinator for Bcph. And the adult campaign is underway with the second booster for 50 plus. That was a hit at the outset. So we're moving in conjunction with our ongoing 0 or 6 month to under 5 vaccine is underway. The clinics were from Tuesdays to Thursdays. We've gone to 1 day a week now. Clinic numbers are hovering around somewhere in the upper 50s on the number of clients signed up. Last week we had 66 registered. We vaccinated 59 folks, so it's really popular. And also, the VFC clinics are, as you can imagine, during the back to school campaign we're under right now. The clinics are filling up. They're actually full. We've got roughly 23 folks signed up for appointments this week for Monday and Wednesday's clinic. We're also looking at the under 50 booster as well. That's coming down the pipe. What type of format will that take place? A mass mass COVID vaccination scale. We're in discussion about what that's going to look like from a vaccination standpoint. So, any questions?
And if you do have questions on anything, please go ahead and put them into chat. And between Tori and Kara, I can't see chat, but they can. And Keith, you can go ahead if you see anything in chat.
Yeah, someone has their hand up. The person with their hand up. I can't see you. If you want to ask your question or place it in the chat, feel free.
Yeah, hi, this is Susan Smith. Keith, I wasn't sure what you were referring to by the clinics. What clinics are you referring to?
Thank you. I'm sorry. These are the clinics held at the St. Vrain Community Center in Longmont on 515 Kaufman. They run, the COVID clinics run from roughly 3 to 7 p.m. It initially started at Tuesdays and Thursdays. We did every other Saturday. The Saturday clinic was from 9 to 3, and that was at the St. Vrain Community Hub. We've gone down to 1 day a week clinic for COVID, and encompasses all age groups on Thursdays. And we've also added, as of last Friday, the MPV vaccine into our clinic schedule, which will take place on Thursday from 6 to 9 as well. And the VFC clinics are at the 2 places either the Sunquist building on Wednesdays in Boulder at 345, it's actually 3482 Sunquist building location. That's Wednesdays from 1 to 6, and the Monday clinic is at the St. Vrain Community Hub on Mondays from 1 to 6 as well. Any other questions?
I have another question, Keith. So does a person just walk into these clinics for the boosters, or do we have to make an appointment?
For boosters, no, your walk-ins are welcome for COVID boosters. Absolutely, we welcome that.
Keith, I was wondering, is there a website or a link that maybe we could put in the chat for people to find this information?
Sure, I will get the link for our community clinics and I can place that in the chat as well.
Thank you.
Any other questions? I see there's still a hand up. Thank you. I'll work on getting that link in the chat ASAP.
Thank you, Keith. And as we move along this meeting, I'll have Kara and Tori continue to monitor chat since I can't see that. So thank you. And Kara, do you want to go ahead with the lead water, and we'll come back to COVID?
Of course. Thanks, Jane. So, so recently there's been some changes or requirements around all childcare and schools having their drinking water tested for lead. And so there is the new House bill requirement, which the next slide we'll talk about. And then Boulder County has also applied for an EPA grant to help with some of the funding for the testing and processing. So Jane, if you don't mind changing, there we go. All right, so the in June 2022, the state of Colorado passed a clean water in schools and child care centers requirement. And essentially it requires all child care centers, family child care homes, and eligible schools pre-K through 5th grade at this time to have their drinking water tested for lead by May 31st of 2023. And through this requirement, there is money set aside to help with the testing, the assistance, education, remediation. So there is funding available for anything that the schools may need to remedy high lead that might be found in their drinking water. And so that is a requirement that, like I said, came about in June of this year. And I have the date highlighted, May 31st of 2023, because that's important. At the bottom here is a link that I have, and I'll put it in the chat as well, that goes to the CDPHE website on this new requirement. So you guys can look at that. So to be able to participate with this program and to look for some funding and such, you do need to sign up. And so here is a link. Again, I'll copy this and put it in the chat for you guys to use, but you do need to be signed up to be notified when the enrollment begins to do this testing. And then the next slide, Jane, it just kind of talks about the timeline. So, you know, they're developing the program now. We're going to start doing some outreach September, October. Then sometimes around, you know, October to May is when they're actually going to ask programs to start testing and remediating any tests or any programs that may have high lead. So I just wanted to show you that timeline of what's coming down the pike. So interestingly enough, Boulder County, prior to us knowing that this requirement was coming about, was looking into participating in a lead water testing EPA grant. And so we just submitted that information or the application and everything for this grant. And so this grant will help support the development of a sampling plan, and will also do the delivery and pickup of testing supplies for lead water testing. I believe this is also kind of new, so I don't have all the specifics. I'll give you what I have. There's probably just more information to come as we learn more. But the state requirement is, I think, you know, they'll pay for the testing, but you have to do it. You have to get the supplies, you've got to do the test, you've got to submit it. The EPA grant that Boulder County is going to be doing will be there to help you through that process, so you're not alone on it. So it's going to be very beneficial. And it is available for, like I said, family homes, childcare centers, schools. We're looking into camps and some other groups that may be able to benefit from this. So we'll be reaching out here soon to see, you know, what sites might be interested in participating in the grant, where we, like I said, we would train, we'd get you the testing supplies, pick them up, submit them for you, do the sampling plan. So like I said, we're kind of in the early stages of this, but I wanted to give everybody the information as soon as possible so you can start planning and thinking about this and maybe doing your own research. But just watch for us to send out some information, and, you know, feel free to reach out to me if you have questions, and I'll do my best at this time to answer any. And I think that's all I got, Jane.
Thank you. Is there any questions in chat?
Okay, so one of the questions was, can we use any certified lead testing company, or are required to go through the state's program? I do know, participating through the grant, they have set it up that the state's program will do the testing. I'm not exactly sure if you do independent, what labs will be required. I'll let you know as soon as I know more. There's also a question, is it the lead testing a one-time, or is it annually, or how frequent? Again, Amy, I'm sorry, I don't know that at this point. I just know that the initial testing for everybody needs to be done by May 31st of 2023. So right now, the other question was, how many people can apply for the grant opening? At this point, we do not have a max amount. So I think if you're definitely interested, let me know and we'll start working with you on that. The question is this a real problem when water tastes funny? And you know, lead is a real thing, and there are, you may not taste lead. I mean, a sad example would be Flint. You know, they had a really, really bad situation with lead in water and people didn't know. So I think from what's been happening maybe with Flint and just what we know about lead, that's why they're asking everybody who is supplying drinking water, especially to a young population, to get tested to ensure that there's not high lead levels. So you may not, like I said, you don't know until you test if you have high lead. So that's all I see at this point. But like I said, feel free to reach out, send me an email. I will give you what information I have at the time, but more to come for sure.
More to come. Thank you, Karen. I saw Toby on the Naropa opportunity. Toby, take it over. Or I'm sorry, not Toby, Bill.
Hi there, everybody. Can you hear me?
Yeah, we can.
Okay, I had a notice saying my microphone wasn't working. Hi, everyone. My name is Bill Monroe. I'm the clinical director at Naropa Community Counseling. We're in South Boulder on just off of Table Mesa. So a few years ago, we started a collaboration with Public Health as a benefit to the early childhood providers that Public Health works with, to provide 9 free counseling sessions to staff members at your agencies. And then after that, you could continue if you're liking the counseling at $20 a session, as much as you needed or as much as appropriate. Just to let you know, Naropa Community Counseling was started in 2015 as a service project Naropa to kind of expand access to mental health and provide low-cost services. We do $30 a session for the community members as well as accept Medicaid. Certainly, I think this is a really nice benefit to take advantage of and tell your staff and those involved that this is available. We do both in person and virtual. There's about a 60-40 mix right now of people doing it through Zoom and 40% in person, although more and more people are coming back in person. We can do individual and couples therapy either for you. And then just to kind of let you know who staffs it, we have second and third year graduate students from clinical mental health counseling programs. Right now it's Regis and Naropa that have those programs, and then Metro has a 2-year school social work program. So those are our current students. We've had folks from UNC before, and we're looking at working with Colorado State as well. You know, some people have a question of what's the quality of services and that with new students and interns. I would just say this, that we're a pretty well sought after internship for graduate students in the area. We do 130 hours of training and variety of topics and counseling interventions over the year. So we require a lot of students, and the results and the feedback we get from surveys, we do follow-up surveys, and we're starting some research. Anyways, services are really generally people like them a whole lot, and you can generally come for whatever issues folks might be struggling with, from anxiety and depression to stress, financial stress or work stress. We deal with most diagnoses, although we have some limitations based on the amount of staff we have overseeing services, the clinical staff that oversee services. We do have, for example, we do see some folks with some substance abuse issues, but it kind of depends on how extensive those are in terms of what we're able to see and help with. But if that's the case, if we were to get a referral and it felt like it was a little bit beyond our scope, we would help find a referral for you. So finally on, one other piece, we also got a grant from Mental Health Partners and have a half-time peer specialist. So someone who's been through their own recovery in some mental health and substance abuse issues, who's not a therapist, and they're just meant to kind of support any obstacles they're having. They also provide a support group, just kind of a mindfulness support group. Those services are free. So I just want to let you know we have those services. If you want to look further into our services, there's our website on the screen at naropacommunitycounseling.com. That's just to sign up. It's very easy. It's very intuitive, but you just scroll down and click on schedule, and there's a pre-screen that we have you fill out that kind of helps us make sure we're going to be appropriate to serve you. And then you'll just make sure to it'll ask who referred you, and just note that Bcph Public Health referred you, and that'll help us make sure to get folks the free services for the first 9 sessions. Just of note, there is an hour and a half kind of full intake out in the beginning to kind of get a full history as well, to make sure we're appropriate for those services for you. Are there any questions? Yeah, we're glad to provide this. We're looking into an expansion into Longmont, hopefully, as well in the next year or two.
Thank you, Bill. And I'll just remind everyone that we'll send these PowerPoints out, so they'll have that link. And if you want to, you can put it in the chat as well.
I'll do that. Thank you.
Thank you. Thank you so much for this service.
Oh, it says, are the free services available on a limited time basis or indefinitely? So again, it's 9 counseling sessions. They're free to use, free to early childhood providers with public health. And then it's $20 a session after that, if somebody would like to continue.
Hi, Bill, this is Nina. Sorry, that was my question. I guess I was just curious, like, does it end at a certain date? That's all.
Well, we have a it goes for a year, and we've been renewing the agreement with public health. So I think it's a certain number of, we're capped a little bit with the number, but we haven't used the full number. So if somebody gets 9 sessions and then we roll into the next year, Jane or Tori can correct me on this, but I think we can then start afresh with another 9 sessions if somebody wanted to start in the next year.
Yeah, I think that's true. And Tori, you can add to this as well, but you've also done a really great job of doing some staff presentations at different programs.
Yes, that's also available. So thank you for reminding me. What we do is we'll come out with a student or two and do an hour kind of presentation on some sort of coping skill or sleep hygiene or some sort of stress management sort of presentation. It can be a good way for providers to see us, see if they get a little benefit from that, and it might encourage folks to sign up. Yep.
Yeah, those have gone over well.
We have one of those scheduled coming up in September with one of the providers. And then there's a question if we have this service in Spanish. We don't consistently, and we don't currently, unfortunately, but it's essentially a matter of trying to hire Spanish-speaking providers. We pretty much most years we do. Yeah. So there's now another question about the type of personal information that we collect. Well, this is considered under, our services are considered a part of a health record under HIPAA. And so we do collect a fair amount of information in the intake about history, but certainly any individual that signs up, we make this clear to folks, they're free to not answer questions if they have concerns about anything. But we do keep a health record on a HIPAA compliant clinical software. And that's, anytime you're providing these services, that's required federally and by state law. So there's another question. Are the 9 sessions with the same counselor? Yes. Generally, you'll do an intake. We can't guarantee that you'll have the sessions with the counselor that does the intake, but most of the time that is the case. It just becomes a matter of if scheduling is schedules don't match and that sort of thing. But generally speaking, you'll do an intake and then have your sessions with that counselor, that same therapist. Another reason you might have a different one is if for some reason you have strong preferences for a different gender or gender therapist or any other specific requests. We try to match those up, but can't always do that.
Thank you.
Looks like that's all of them. Thanks.
That's it. Thank you so much. It's such a great service, and really appreciate the work.
Yeah, we appreciate collaborating with you. Thanks very much.
Thank you. So I backed up the slide deck to let Carol Hellig give us an update. Carol, are you?
Yeah, I'm here. Can you hear me okay?
Yeah, we can. Thank you.
Great. Thank you. So I'm Carol with the Communicable Disease Program at Boulder County Public Health, and this program has been around for a very long time. It's a core public health service to follow up on infectious diseases. And as I'm sure everyone knows, because the whole community has been busy over the past 2.5 years with COVID, our primary focus has been the COVID response. And I am so very grateful to all of you and your facilities and the enormous lift that everyone did to respond to COVID and adapt to COVID prevention measures and everything that everyone went through. So first and foremost, my gratitude to everyone. And now things have shifted. I know that Elena has shared these similar slides with you before, that we're transitioning away ramping down response. Things have shifted very much towards certain priority settings. And when we detailed those priority settings, ECE was definitely still considered a high priority setting because vaccinations had not yet rolled out in the 6-month to 4-year-old children. And thankfully now those vaccines are available for 6 months and up. And so we have not completely received notification from the state that outbreaks are no longer required to be reported the way that they are no longer required in the K through 12 settings. But now that vaccination is available, we do anticipate that over time, the state will likely no longer require us to report those outbreaks, potentially. In the meantime, your facilities are no longer required to report individual cases to us anymore, and staff and students. I know that Elena has provided just tons of resources for and her team to follow up on what to do if you do have someone who tests positive, either a staff or one of the children. And if you do see a cluster or an outbreak, or you have concerns, we are here, of course, to support infection prevention measures, as we always have, not just with COVID, but if there's an outbreak of GI illness or any other thing. I know hand, foot, and mouth always goes around the child care centers, those different things. We're always here to support your facilities with infection prevention supportive resources. And oh yeah, there's tons of data resources there. I want to see, I don't know if this one has the COVID Community Tracker from the CDC. So those are just two things I want to go over really quickly that will help now that we're not going to be coming back to provide regular surveillance updates. Those resources are all great. It has all of our information on there. Some of them might not be applicable to your facilities, like the CU one. But I want to point you to one, and I'll put this in the chat as well. It is the CDC's Community Tracker page, and I'm going to share my screen and go through how it works. Let me just move it here. Are you able to see my screen on the board?
Yes.
Okay. So this link that I just put in there, it lets you search by state and county. So I'm just going to click in here and put in Colorado and Boulder. And this updates every Thursday. Every Thursday evening, it updates and it tells you the level that we're at. And so we are currently in level medium after having been in high for a little while. And we also have on our page, which I'll also put this in the chat, we update this page every Friday after the CDC updates it on Thursday with where we're at and more like local information and available to the community. But with the CDC Community Tracker, it shows that we're medium. These are the prevention measures. So basically, if we're in medium, we add, like, these are iterative, so everyone should always stay up to date with COVID-19 vaccines and always get tested if you have symptoms. Those are the only two measures when we're in low, which we're heading towards low, hopefully, although with the K-12 schools going back into place, we could jump back into high because school's been out for a while and always going back. We see a lot of disease transmission. That's what we've always seen every fall since before COVID. But so here in medium, if you are at high risk of severe illness, talk to your healthcare provider about whether you need to wear a mask and take other precautions. So someone who may be immune compromised or something like that, when we're in a level medium, may still want to take additional precautions, like your staff, if you have anyone who's immune compromised, or children. Keeping parents informed of where the level is at is probably a good thing to do, just so parents can be aware. And of course, they still have to stay up to date and get tested. And so when we're in high, is there's no public health order in place at the state level or at the local level for masking. But when we're in level high, the recommendation is to wear a mask, totally optional to do so for the public. And I guess it's based on each individual's risk level, and you know, vaccination status and all these different things. But these are basic precautions recommended by the CDC and how they track up and down. And we have them here as well. And the difference with this tracker and the other ones that we've had in other phases of the pandemic is that this one takes into account hospitalization levels. And I'm not going through all of this stuff, so don't worry about it. But this is where it comes from. So whenever we're below 200 per 100,000 cases, we can be in level low, for example. We were recently above the 200 per 100,000 cases, and our hospitalizations had also dipped into this level. But right now we're below the 200 per 100,000 cases, and it did go down from, it's been 2 weeks now that's been below the 200 threshold. And our hospitalization, new admissions are still in this medium level, so that's why we're in medium. But we do anticipate that may continue to trend downward, hopefully. So this is just everything in a nutshell. I'll stop sharing my screen now, but I would share that you know, some people have already started saying like we've reached endemicity and all these things, but I know it is a transition. And you know, with your sector being the one serving children who only recently were able to access vaccination, and that still may be ramping up, may still be seeing more transmission in your age group. Also, I know vaccine uptake, although I think it's been kind of strong in our jurisdiction, it's maybe a little slower than it has been in other age groups too. So lots of special considerations there. And we don't want to say it's over because it's just with us now, but it has shifted a lot. And so we're, like I said, just grateful for the big heavy lift that everyone has had over these past 2.5 years. And as we move forward, I think one of the important things for us is to go back to all of these diseases that we have not been ignoring, but I think because we have COVID and so many mitigation measures in place that are no longer going to be in place, we may see the return of pertussis and other illnesses that haven't been as prevalent because of the COVID mitigation measures. So the ideal thing is for each facility to work with your child, with your nurse consultants. And then if you ever see a cluster or an outbreak of respiratory illness or otherwise, please reach out to us and we can support containing outbreaks of any kind, not just COVID.
Earl, there is one question in chat.
Okay.
About why early childhood is considered higher risk.
Oh, yes. This is because at the time that the state last updated, ECE was not yet eligible for vaccination because you had the 0 to 4-year-olds and only 5 and up were eligible for vaccination. Now that the 0 or 6 months and up are eligible for vaccination, the child care settings may not be required to report outbreaks anymore. But for now, we have not received that green light to completely deprioritize the way that we did with K-12. So, but we, and perhaps they're just giving it some time, you know, because K-12, the 5 and ups had at least like 6 months or more of the vaccine being available before we no longer had to report the K-12 outbreaks, for example. And so I don't remember off the top of my head exactly when the 6 months and up became eligible for vaccine. but it'll likely be at least 6 months out from that time period, so people have time to access the vaccine and get their kids protected if that's their choice, before we're rolling back and completely deprioritizing. Yeah, and so the reason for those outbreak reporting purposes, I think, is because of vaccination not being available and needing to ensure, since in the absence of vaccination for the population served, needing to ensure that we're taking extra precautions to reduce transmission and work on those outbreaks. And I'm going to read through the next question. Will it continue to be that if our younger children who are not vaccinated are exposed at home, that they will have to quarantine, but if vaccinated, they can attend school unless they have symptoms? So I think, and I hope that you can help me, Jane, but aren't children, yeah, I don't want to mess this question up because it's a very technical, detailed one, and I am not the guidance expert.
And we will continue to have, I mean, we've gone through a lot of those theoretical kind of things, and we will continue to have our Healthy CE email for another year. So without a public health order, some of those things, especially asymptomatic, will probably need that specific. Yeah, thank you, Kaylin.
And oh, good. Kaylin, thank you for being here. If children and staff are up to date, they can continue to attend care as long as they remain symptom-free and do not test positive. Yeah, so if up to date on vaccines, they can keep going without symptoms. Okay, but if unvaccinated children with a household contact should quarantine. Thank you. I didn't want to say the wrong thing. Perfect. And then you are considered an outbreak if there's 5 or more. Yes. And that would be, for example, if you have one child who tested positive and then like on a PCR, for example, and then 4 children who are symptomatic, but they have done or not done the test. Like, hopefully we can encourage everyone to do those tests if they're symptomatic, so that we at least have a home test. But yes, 5 or more is an outbreak.
In 2 weeks from different households.
Within 14 days. Okay, thank you for that, Kaylin. And I think that's everything, but yeah.
School.
Perfect. Yeah, and please do let us know if you need support with any other things too, and also work with your child nurse consultants.
Thank you, Carol. I don't see any questions, but if hopefully you can stay on for a little bit, or Kaylin, and we can continue. If there are other questions that come up, go ahead and put them in chat. If we can't get to them today, we will get back to you.
Great. And I do have to jump off, but I'll monitor the chat.
Okay.
Okay.
All right. Thank you.
Bye.
And so then I will move us to the partner update, and then we have some time for another special guest from 9Health. So is Jody Sherman on for CCAP update?
My microphone was getting sticky on me in the mute. Sorry about that.
That's all right. Thank you, Jody.
Sure. So good afternoon. Thank you, Jane and team. I don't have much, but I am happy to report we had 3 new fiscal agreements with providers last week. Although on the flip side, they were all with providers that were outside of Boulder County. So we would love to add some new providers and increase access for CCAP families within Boulder County. Please, let me know if you have any questions about any changes that have happened with payments or the attendance tracking system. I'm happy to spend some time with anyone considering opening up a contract with us. It's a great and fairly easy way to promote racial and socioeconomic equity for families in Boulder County. So, and then also if this entices you at all, a reminder that CCAP now pays and continues to pay per authorization rather than by attendance for children ages 0 to 3. So that's, you know, a lot of the children in this community or who go to your sites. So if you were concerned that, you know, a child was going to be absent and you wouldn't get paid, those days will now, as long as they're authorized, be paid. I'm going to go ahead and stick my information in the chat, so feel free to reach out, and no question is too small. Happy to talk with anybody about CCAP. Thank you.
Thank you, Jody. I really appreciate your work on that. Amy Carlo, I think I saw you, or Mary from the Early Childhood Council, Boulder County.
Hi, yes. We have 2 cohorts starting here real soon for expanding quality in infant toddler care, EQIT. The Tuesday cohort starts tomorrow evening with orientation, and the Saturday cohort starts on August 20th. And we still have several spots available for the Saturday cohort. So just wanted to encourage anyone, if you have new teachers who haven't taken EQIT, it's, as many of you know, have probably taken it, excellent course, also can include coaching for your educators, and registration is still open. I'll put our the link to the registration in the chat, and lots of spaces on Tuesdays. It's alternating Saturdays starting August 20th through December 3rd. So there's some, it's not every Saturday, so you get a few Saturdays off. And that's about it. Thank you.
Thank you, Amy. I'm not sure if we have anyone from the Department of Early Childhood. We have to get used to the new name, which we're so excited about. Is there anyone available from that would have an update from the Colorado Department of Early Child Care? We'd like to leave space for them, but I know it's probably crazy busy time for them. All right, then, maybe next time. So I do want to leave space for 9 Health. Leslie, I saw that you called in, and we do have about 10 minutes if you want to talk a little more about the program you have.
Great, thank you so much. So hello and good afternoon to everybody. I'm Leslie Levine. I'm from 9 Health 365, and I am with you today because I have some experience with the early childhood sector. I came from Cooking Matters and was overseeing the Cooking Matters for Childcare Professionals training. And so that's where I really was able to dig in and begin to understand the early childhood sector and some of the challenges that you're facing. So when I came to 9 Health 365 to work on this new program, all I could think about is how this could be an opportunity to break down some of the barriers to be able to access preventive health and medical care. Jane, I'm not sure if you put all of the slides in there or just a couple, so let's see what comes up next.
Just put a couple, but I can certainly switch to your other one.
You know what? I think I'll just go ahead and talk, and we'll see what we can get through. So what we have put together, so folks may be familiar with 9 health fairs. We've been around for about 40 years, and they're a really great place for people to be able to go get blood screenings that are much less expensive than if you were to go to a doctor's office. For folks who don't have insurance, it's a really good place to get all kinds of preventive health screening. So whether it's a blood screening, your blood pressure, eye exams, women's and mental health, women's and mental health exams as well. And so those are really popular. And what we heard from some people is, this is great, but I don't have insurance and I don't have a doctor. So what am I supposed to do with the results from my screenings? And so we've put together a new program that does include a blood chemistry screening with 28 measures of health. So how do we help you identify some of your risk factors for chronic disease? Let's catch it early, because we know that that can save you a lot of time. It can save you a lot of money. And really, when it gets down to it, it can save you a lot of heartache. Having to go through life with diabetes, high cholesterol, no one wants to have to address that on a regular basis. And so we've paired this blood chemistry screening with an on-demand telehealth service. And so if anyone wants to chat in, have you used on-demand telehealth before? We've got a couple of extra minutes than we thought we might. So either if someone wants to unmute or if someone wants to chat in, if they've had experience with on-demand telehealth. Let's see if we have a participatory group for this conversation. All right. So let me go ahead and describe what on-demand telehealth is. So it's not necessarily your doctor. It's not your nurse practitioner, but they are the company that we've partnered with. Is a national company, and they're all primary care physicians and psychiatrists. And they are available 24 hours a day, 7 days a week, 365 days a year. And yes, they have the ability to provide assistance to Spanish speakers. They have interpreters for over 250 languages. So with this telehealth service, you start out with texting. You open up an app and you begin to text with the doctor, and very quickly you can start to talk about what is your medical question, what is your medical concern. You will be able to easily switch over to a phone or video call to bring in an interpreter. If you are a Spanish speaker, if you go to the internet, you can request a visit with the doctor, and you can do texting with live translation in Spanish. They'll be expanding to other languages as that service ramps up. Can you only use this if you don't have insurance? So this is something that is available to anyone. You can have insurance. You don't have to have insurance. You do not have to have any kind of documentation or identification. I think this is another great reason to bring this to the early childhood sector, because we know that some child care centers are able to offer insurance. The premiums might not be affordable because, unfortunately, the reality is there are some very low wage workers who are working in centers. And so if you aren't able to offer insurance, if your employees are not able to participate in the insurance, this is something that's available to them. If you can offer insurance, but you have a high deductible health plan and people don't necessarily have the ability to put money into a health savings account, this is something that can really help them reduce those out-of-pocket costs, because there's never any copays. So it's $99 a year, and you can use the telehealth portion of the service as often as you want. The blood screening you would get done once a year. I'm trying to keep up with the questions. All right, these look like these are other questions. So it's not necessarily insurance, so it won't meet that requirement, but it's something that's really flexible that can support your staff. It's something, if you are an administrator of a child care center, you know that it's really hard to recruit staff right now. And so this is something that you could offer people upon hiring. You could offer to people after they've stayed for 30 days, for 90 days. You can offer it to all of your staff as something to show them that you value their health and you value your employees. You just have a tight budget and might not be able to have as robust of a benefit package as you would like. And so right now we're working with employers to be able to offer this for their staff. So again, it's $99 a year. Later this month, it will be available for individuals and families to purchase. So it could just be something that you all might decide, whether you have a high deductible plan or you don't have very good access to medical care. This is something that you add in for your families. But we know that it's hard for people to take time off because it's hard to find substitutes. If you're a family child care provider, that makes it even harder. And so we want to be your partner in trying to make sure you can support your staff and their health journey. You can be available to the families who are so dependent on your care. And so that's why we're here with you today to share this information. I can also do presentations for individual child care centers if you'd like to learn more, or if you want to set up a meeting with me to see if this is something that would be a good fit for the staff in your center. So I'll pause there and see if there are any questions or comments.
I also want to add that Leslie offered to come to any of the, I know there's a few groups, director groups and so forth that are meeting, that you could get on their agenda as well, because this is such a great opportunity. And especially at a time like this, when we really want to care well for our early childhood community.
And I will add, we will be in Boulder in October in partnership with the Boulder JCC. We'll be doing a health fair, and I thought there were two, maybe there's one this coming fall. So you would have an option to get that blood screening done either at a Quest Patient Service Center, or you could go to a health fair if you want to take advantage of the other screenings that are available. All right, so everybody has my contact information there. I'd love to chat with you if you think this would be of assistance to your staff, to your recruiting efforts, to fill out the staff if you've got any vacancies, if there's something that could help you. I'd be happy to set up a meeting. So thank you very much. Thanks, Jane, for the opportunity.
All right, before I open it up for any other questions, I just wanted to make sure that we covered this last bit of information, that we will be moving to a quarterly meeting beginning October 10th at noon, unless we have a reason to meet more often. At this point, it feels like the right amount of information to host a meeting would be quarterly. We will continue, we mean me mostly, I will be updating on email as I have new information. And we will continue to have the Healthy CE COVID email for COVID cases and questions. So that is not going away, at least not for the next year. So keep that in mind. And I know you have my contact and Kara Kaiser and Tori and Victoria Lee. So you can contact any of us as needed, but we are moving back, trying to move back into our new normal pre-COVID. So we will keep this meeting on a quarterly basis as kind of a transition, and as things come up, we'll email you on an ongoing basis. But I'll open it up for this last few minutes to see if there's any other questions we mentioned. Oh yeah, Amy, monkeypox. Know if there's anyone left on the call. I know Carol had to hang up. Kaylin or any of the EPI team available to talk about anything that it's pretty new. I know we're just working on it with the monkeypox information. Anybody on the call that might be able to answer that? Kaylin, do you have? Oh, good. Thank Kaylin. Kaylin put into chat. I don't know if some of you on the phone don't have access. We'll send this out, but there wasn't anything ECE specific for monkeypox precautions or guidance that child care programs need to follow. If children are presenting with rash-like features, they should have the family consult their primary care physician, and you as a child care provider should and begin to use, if you aren't already, the how sick is too sick. That has exclusion criteria for many things. And that we can put that link in chat as well. We don't have any monkeypox testing. Should be evaluated by their healthcare provider. Great. Thank you, Kaylin. I know that definitely is coming up more often. Is there any other questions? I'm going to put the how sick is too sick. Assuming the same applies to staff. Yeah, I assume the same, Amy. Kaylin, do you have any thoughts on the same guidance applies to adults as well as children? gave it a thumbs up, yeah. That is an upcoming, as we gather more information, we put any of those updates on our website, but if there's any more urgent information, I will be sure and send that out as an email. But continue to, if you have specifics, we've gotten a couple people emailing us who their physician had suspicion, but they had no positive test and ended up the children did not test positive for monkeypox. But let that be your first level of intervention. Have them go directly to their healthcare provider. Your nurse consultant should be up to date on that as well. But the ones we've talked to so far, a child had of some sort of thing, did not test positive for monkeypox. So have them go directly to their healthcare provider. And as always, if there's other symptoms, a child or staff should be excluded if they have symptoms of other illness, of any illness. I'm not seeing any other questions. If we missed your question and you have one, you can unmute or put it in chat. But we will get this recording on a link in the PowerPoint slides, so you can have access to that data. And I'll get that sent out in the next couple days. If there's no other questions, I'll go ahead and close. I've got a couple minutes, and I'll stay on if anybody has a pending thought, question. Again, I also want to echo what Carol and others have said, is that your diligence, your work in this early childhood community is so appreciated. We really appreciate your attention to health, your attention to care. I know it's a trying time. There's a lot of things changing with the Department of Early Childhood, with little and big things, lead water testing, and so forth. But we're here with you.